The first person diagnosed with Ebola in the U.S. is in Dallas, being kept in isolation. Dr. Jeffrey Kahn is the chief of pediatric infectious diseases at Children's Medical Center, UT Southwestern as well, and joins us this morning. Thank you so much for being here. This is a big deal, and you've been studying this for a long time. You've been looking at all the research. The fact that it's now out of West Africa is huge.
To me, that's the most significant development here. I'm quite confident that the public health resources here will be able to control this particular case and if there's any secondary cases. But the most significant issue is that the virus has now left West Africa.
And other countries might not be as prepared as the U.S. is in dealing with something like this, so it really could affect the whole world. That's
absolutely true. With the way that air travel is nowadays, somebody can get on a plane and travel anywhere around the world in a very short period of time. We know that the incubation period for this virus can be as long as 21 days. So one can imagine that there can be a lot of travel, people be carrying the virus, not even know it, and take it to other parts of the world where the control processes are less than what we have here, and the virus could spread in different populations.
And someone's not contagious until they are showing symptoms, right?
If there's any silver lining here with the Ebola virus is the fact that individuals do not shed virus, are not contagious until they're very sick. That's different from influenza or measles where you can spread the virus before you're sick. So again, that may be the only silver lining that we have. We can identify ill individuals and isolate them. And that will help us in preventing the spread of the virus.
Which immediately needs to be done. It seems like in this case it was a couple days before this person was actually determined that they possibly were sick with Ebola. So that's obviously a serious concern.
Right.
We're getting a lot of questions from viewers this morning. Some of them, here's one. How long does the virus live on the surface?
Typically,
this one's actually our mosquito one. Can a mosquito spread the virus if it bites an infected person? This one's from Marcy Jones.
So there's no evidence that the virus can be spread by mosquitoes. It's typically close contact with an individual who's sick, and it's contact with bodily fluids.
Okay, when you say bodily fluids, is that coughing, sneezing?
It could be respiratory secretions. It could be...
Someone would have to cough in your face,
right?
I mean, it'd have to be something in that close of contact.
Right, so typically the patients who have the severe form of the disease, they bleed a lot.
Okay.
They have blood from their mouth, they have blood in their stool, and it's exposure to that type of fluid that can spread the virus. So again, these patients are typically very sick, and that's when they shed a lot of virus.
Yeah, and as far as how long this virus lives on the surface, back to our other viewer question.
It's not clear. We don't have a lot of good data on that, but with the data that's coming out of the West Africa outbreak and previous outbreaks, again, it's close, intimate contact with an infected individual.
How far are we from a vaccine, from developing more of this ZMapp medicine we've heard about that has actually helped some that have come down with Ebola?
There are a number of vaccines that have been developed. Some of them actually have been tried in primate models and seem to be very effective. However, there have been no human trials of these vaccine candidates. So at this point, I think that, that if we identify a potential vaccine candidate, it's going to be sort of on the fly. We're going to have to give it during an outbreak. Not the ideal circumstances to test a vaccine, but on the other hand, we have to get this outbreak under control. And if we don't, it's going to continue to spread throughout Africa and throughout other parts of the world.
Yeah, which is something we definitely don't want to see. Thank you for joining us this morning. We appreciate it.